Nurse's Guide to Traction Care and Management. A nurse's guide to traction care and management involves understanding and implementing traction, which is a therapeutic intervention used to treat musculoskeletal injuries, fractures, and spinal conditions. Traction involves applying a pulling force to a part of the body, typically through the use of weights, pulleys, and straps. Here's a background on key aspects of traction care and management for nurses. Types of traction. Skin traction involves applying traction to the skin using adhesive straps or boots. It's used for short-term immobilization and to reduce muscle spasms. Skeletal traction uses pins, wires, or screws inserted into the bone to apply traction directly to the skeletal system. It's often used for long-term immobilization and to stabilize fractures. Indications for traction. Fractures, especially long bone fractures like femoral fractures. Spinal injuries such as vertebral fractures or dislocations. Musculoskeletal conditions like hip fractures, limb length inequality, and certain joint dislocations. Assessment and monitoring. Assess the patient's neurovascular status regularly, including sensation, movement, and circulation distal to the traction site. Monitor skin integrity under traction, looking for signs of pressure ulcers or skin breakdown. Ensure proper alignment and positioning of the traction device to maximize its effectiveness. Patient care and education. Educate patients about traction, including its purpose, expected duration, and potential complications. Assist patients with mobility and activities of daily living while they are in traction. Provide emotional support and address any concerns or questions they may have about the traction treatment. Complications and risk management. Complications of traction can include pressure ulcers, nerve damage, circulatory impairment, and joint stiffness. Implement measures to prevent complications, such as regular repositioning, skin care, and neurovascular assessments. Promptly report any signs of complications or changes in the patient's condition to the healthcare team. Collaboration and multidisciplinary care. Work collaboratively with orthopedic surgeons, physical therapists, and other healthcare professionals involved in the patient's care. Participate in interdisciplinary rounds and care conferences to discuss the patient's progress, goals, and treatment plan adjustments. By understanding these aspects of traction care and management, nurses can play a crucial role in ensuring the safety, comfort, and effectiveness of traction therapy for patients with musculoskeletal injuries and conditions.